Olá, boa tarde, boa noite. Eu vou primeiro agradecer pelo convite de participar desse evento, pelo carinho dos organizadores. O meu discurso, na verdade, vai ser em inglês, apesar de ser brasileiro e ter esse nome holandês. Deixa eu achar aqui a apresentação. Posso aumentar? Bom, o que é a TAMPEP? TAMPEP is a network of community-based service providers operating in 28 European countries. It was founded in 1993. We are a regional network and member of the Global Network Sex Work Projects and ICRSE, the International Committee on the Rights of Sex Workers. TAMPEP's main objective is to reduce HIV vulnerability among migrant and national sex workers, and to promote human rights, equality, and accessibility in public health for sex workers. So a little bit on vulnerabilities. The most significant factors regarding sex workers' vulnerability to HIV STIs is the high and disproportionate levels of violence and abuse identified across Europe. This violence can be institutional, from the police and public authorities, or related to exploitative and unsafe working conditions. As Antonio mentioned today, violence against sex workers must be understood in a wider context of gender-based violence, marginalization, discrimination, and stigma. Dependency on third parties and weak legal position of many sex workers, particularly migrants, are added factors to their vulnerability. Escalating state repression, criminalization on sex work has made sex workers more vulnerable to HIV STIs in several ways. It has forced them into working in clandestine spaces, reducing their access to health care and prevention measures, undermining their dignity. As Peter also mentioned today, societal homophobia, laws against homosexuality, and absence of legal protection from violence and discrimination are serious barriers for transgender and male sex workers to access sexual health services and information. These problems are usually heightened for migrant sex workers, particularly if they are undocumented. Evidence shows that large majority, more than 70% of sex workers in West European sex industry are coming from 65 countries of origin. Most are highly mobile and coming from Central and East European countries and Central Asia. 65% of all migrant sex workers are non-EU citizens. That means that many migrant sex workers in Europe today experience, as an added factor to their vulnerability, social exclusion and social exclusion, the consequences of repressive migration policies and barriers to access health and social care. Due to increasing repressive policies and new trends on criminalization on sex work in the last years, mainly towards street-based sex workers, Europe has seen a shift from outdoor to indoor forms of sex work. Nowadays, about 2/3 of sex workers are indoor-based. This is a fact that has made it difficult for service providers to establish and maintain contacts with sex workers. We estimate that about 30% are covered by information, prevention, and care measures. Many sex workers are moving to indoor indoor settings, and few organizations are able to carry out outreach work in closed sex work settings. This is a gap that needs to be taken into consideration. That's why today TAMPEP is participating in a project called Indoors, specifically targeting indoor sex workers, together with APTIS and Protokipiste that are represented here. And peer education and sex work expertise need to be used for better coverage of sex workers in indoor settings, together with a strong program for sex worker community leadership support. On top of that, the discourse merging sex work and trafficking has been used to justify restrictions on migration and prostitution. The criminalization of sex work has double effect on migrant sex workers and creates double illegality as migrants and as workers. So this is a picture of Alkmaar. It's a city in the Netherlands, and even in a country where sex work is legal, this red light district of Alkmaar was closed in a suspicion of trafficking, and sex workers that used to work there, around 80 women, they lost their working place, and they gave no option to them, so they had to move to other forms of settings. In some countries of Europe, HIV, STI testing is mandatory and breaches of confidentiality are common. Laws that criminalize sexually transmitted infections pose a particular threat to sex workers. In some countries, sex workers are found to be HIV positive, were charged with public health offenses. For example, last year we had this case on Greece, which many migrant sex workers were arrested on the streets, they were forced to test, and when they found that they were HIV positive, they had their image exposed in newspapers, and now they're being charged for criminal offenses. Therefore, particular attention must be taken to the language and methods used in research and surveillance data related to HIV status of migrant sex workers, since this group experiences heavy stigmatization and criminalization policies. Migration and sex work should not be considered a threat to public health, yet laws and policies that put them at risk. One of the biggest barriers in the last year is the lack of political commitment and governmental responses focused on reducing sex workers' vulnerability to violence as an important factor affecting vulnerability of sex workers to HIV STIs, and the absence of adequate public health approaches that are appropriate to HIV and HIV prevention and human rights framework. So considering this context, there's a need of quality services. To be effective, programs for sex workers must be dynamic and grounded in human rights and what sex workers want. They must address the diverse realities of human sexuality and sexual expression, and not moralize or try to push sex workers into other occupations. However, many of the HIV programs aimed at sex workers take a very narrow approach by focusing strictly on HIV testing and condom distribution, without addressing structural barriers that put sex workers in a higher vulnerability to HIV. Moreover, it should be highlighted the lack of universal access to HIV treatment, particularly regarding undocumented migrants. The right to health is an inclusive right and demands equality in its fulfillment. The result is that many sex workers today are obliged to work in clandestine and illegal situations. A range of laws, policies, and social attitudes erode sex workers' right to make free, informed, and autonomous decisions in respect to their sexuality and reproductive choices. Sorry, I skipped some. Few services meaningfully involve sex workers in their design and implementation, with involvement generally limited to using sex workers as peer educators. It is also true that sex workers' community involvement is more than implementing peer education programs. It relates fundamentally to the need of supporting sex worker communities and sex work-led organizations in advocacy for their rights. Finally, there is no single model for reducing the risk to HIV among sex workers and clients. Rather, a combination of right-based services and policies tailored to particular settings has proven to be successful. The several vulnerabilities of sex workers are accompanied by a growing social exclusion and barriers to accessing social and healthcare support services. In order to strengthen HIV and STI prevention in sex work across Europe, it is critical to address structural barriers that put sex workers at risk. Therefore, we recommend, go very quickly, to develop a holistic, coordinated, integrated approach to sex work and HIV, STIs. Involvement of sex workers is indispensable to create this framework. To develop a national referral mechanism like you have in Portugal, a structure that monitors and makes recommendations for national policy concerning the reduction of vulnerability among sex workers to HIV, STIs. To create a supportive coalition that includes civil society, government organizations, international agencies, and sex worker-led organizations, which continuously monitors policies on sex work, their implementation and outcomes, supporting sex workers' rights, and combating discrimination and stigmatization. For example, combating laws that criminalize sex work and monitor the impacts on public health. To ensure that sex workers have the access to services that they need and that their human rights are respected. The promotion of sex workers' human rights and access to justice is fundamental for any HIV program for sex workers. This includes addressing and combating discriminatory laws and violence and abuses that put them at risk. To ensure the participation of sex workers in all discussion and levels, to promote and train and integrate peer educators in every outreach team, to ensure access to health, which includes guaranteeing migrants and ethnic minorities access to HIV prevention, treatment, and care measures. Services should be able to reach diverse sex work venues and communities, especially those which are more isolated, hidden, and distanced from support services. To promote synergies and resources and policies on national, regional, and global levels. And sorry, the last one, and perhaps the most important one, to recall states' responsibility for the provision of appropriate levels of sexual health and social care services to migrant and national sex workers, considering these services as an integral part of the fulfillment of the right to health. Muito obrigado.